Learning about chronic respiratory diseases can feel like trying to navigate a maze in the dark. It's complex, with many twists and turns. Visual aids are like a beacon of light, illuminating the path to understanding. Think about it. Wouldn't it be easier to understand how our lungs work by looking at a diagram rather than just reading about it? That's the power of visuals. They transform complicated medical terms and processes into something we can actually see and grasp. Instead of memorizing facts, we begin to truly comprehend the inner workings of our respiratory system. This visual approach helps us connect with the material on a deeper level. It's no longer just textbook knowledge, but a clear picture in our minds. This deeper understanding, in turn, helps us retain information better and apply it to real-life situations. Imagine our respiratory system as a network of airways, like a complex map with different routes for air to travel. At the entrance, we have our nose and mouth, the starting point of our breathing journey. Air then travels down the trachea, a passageway that branches into two bronchi, each leading to a lung. Think of the bronchi like highways that further divide into smaller roads called bronchioles. These tiny pathways lead to millions of tiny air sacs called alveoli, resembling clusters of grapes. It's here in these alveoli where the magic happens, the exchange of oxygen and carbon dioxide.
Dr. Valentino, to the OR, please.
Chronic obstructive pulmonary disease, or COPD, is a group of lung diseases that obstruct airflow, making it difficult to breathe. Imagine a balloon slowly losing its ability to inflate and deflate. That's similar to what happens to the lungs with COPD. Over time, the airways become inflamed and narrow, making it hard for air to pass through. The air sacs, those tiny alveoli we talked about, lose their shape and elasticity, further restricting airflow. Section 4. When breathing becomes a battle, witnessing an asthma attack. Asthma is like a sudden storm in the airways. Imagine smooth, open airways suddenly constricting, like someone tightening a belt around them. This is what happens during an asthma attack. This constriction is caused by inflammation and mucus buildup, making it difficult to breathe. Muscles around the airways also tighten, adding to the blockage. It's like trying to breathe through a straw with something blocking it, a scary and uncomfortable experience. Section 5. Beyond the surface, chronic bronchitis versus emphysema. Chronic bronchitis and emphysema are two common types of COPD, each affecting the lungs in different ways. Think of it like this. Chronic bronchitis is like having a persistent cough with mucus, while emphysema is like having damaged air sacs that can't hold air properly. In chronic bronchitis, the lining of the bronchial tubes is inflamed and produces excessive mucus, leading to a persistent cough and difficulty clearing the airways. Emphysema, on the other hand, destroys the walls of the alveoli, those delicate air sacs responsible for oxygen exchange. This damage reduces the lungs' ability to expand and contract properly, trapping air inside.